little needle is going to be putting color into the skin.
How big is the needle?
You can kind of see it poking through there.
Okay.
And you use different needles depending what you're doing. So I don't use the same needle for liner as I do eyebrows because you want the line to be more fine for brows and like little hairs. And there's different widths for liner too depending on what you're doing and how thick you want the line to be. I am very conservative, so I don't
always add more, right?
What's that?
You can always add more.
Exactly, exactly. So I don't like to do a real gaudy looking eyeliner. Even if I have a patient who comes in and tells me they want it really thick and black, I don't do it thick and black. I'm going to grab this bright light you're going to see here, Brie, okay? So I've had the numbing on her lids for about 15 minutes. And what the numbing does is it just desensitizes the skin. So she's not going to feel as much prickliness. She's still going to feel vibration and sensation, okay? Bring your chin up for me quite a bit. Thank you. The irrigation is just an eye wash, and this just helps to kind of keep the wiping to a minimum.
My eye is burning quite a bit.
Okay, which side?
This one.
This one? Okay. Better?
Yes, thank you.
So you will feel me kind of holding your eye snug.
No texting with me.
Bring your chin way up, almost like you're extending it, if you can.
Sorry, I just got dizzy.
Okay, are you all right? Okay. So you'll feel me holding your eye snug. I'm going to turn you just a bit. And you'll just feel kind of a weird irritation sensation here. You okay? You all right? Okay.
Did she use Valium?
Nope. Nope, she's just a tough cookie. Slow, easy breaths, girlfriend. So what I do is I basically kind of go over the lid, add some color. You can kind of see a little bit of color there in the lash line starting. You see that? And then I put more numbing and go to the left side. And then I just kind of go back and forth, and that way the comfort level is going to stay more comfortable. So when I put this numbing, it may sting for just a moment, okay? Okay, so I'm going to switch to that side. So I'm going to go over there.
Wait, 1 second, please.
Oh, did you?
And turn towards me a little bit. Good. And you're going to feel me irrigating over here. So we're doing just a thin black line for Bree. She wears black every day. And then she'll come in a couple months. We'll touch it up. And the touch up is just to add color. If she wants to go thicker or darker, we can darken it at that time. When patients do the liner like this, I do always tell them that they can, you know, come in and have a driver bring them, and we can offer them a little oral sedative if they want. It just kind of relaxes them a little more. The key is you just want to be able to hold still and not be, you know, squeezing or moving. So if somebody's really anxious about it, then that's kind of what we'll do.
Does that hurt?
No. It's just odd.
It's like an irritation, kind of a tickly irritation. But the numbing cream does a pretty good job.
Sorry.
What is it? The needle?
Yeah, it's a needle putting color into the skin. Is it prickly? One moment, I'll put some more numbing. Right in the lash line. Yep, that's a true liner. Just right in that lash line. So you'll be able to see here in a moment, just going one pass, you already get some nice color in there. So you can see, turn a little this way. Do you see already? There's just a little color. So that made little openings, and then I'm putting a secondary anesthetic on, which will help kind of desensitize the skin even more.
Is it hard to do the bottom?
No. I've been doing it since 2003, so I've done a lot of these, and it doesn't cause me any anxiety, and I'm pretty comfortable. I've worked in ophthalmology for a long time too, so that kind of helped me when I started doing this, just feeling comfort, you know. I'm gonna go back to this side.
Yep.
Is there a chance of infection or anything?
Definitely. You know, if a patient doesn't follow the aftercare instructions, that is an open wound for about 5 days. So you can't be touching and manipulating. You have to be very careful when you're out not to touch your face. But I've never had any issues with patients getting infection if they follow the proper, you know, aftercare. So now I'm going to irrigate again over here. Turn to me a little bit. Good. Should be less prickly.
Is it alright if we talk to you while you're doing this?
Sure.
So if you want to come back and have it thicker, does it cost more?
Well, one touch-up's included in the price. So we do it twice. And usually at the touch-up, if the patient wants it thicker and darker, that's what we do. And they're usually fine after that.
What's the price?
For upper and lower, it's $500, and then you would get 25% off today. If you do just upper, like she's doing, or just lower, it's $350, and then 25% off today. Should be less prickly. Try not to squeeze. Little better.
That was music for her.
Yeah, but it's soothing.
Very nice. Sorry. How was that? That was a great plan, huh?
And you want to be right in the lash line. Over the years, I've seen patients come in that have asked me to fix their makeup where they've had it done at these salon type places and it's higher than the lashes or lower. Not a good look. It's really unfortunate, and I tell them, oh, there's really nothing, you know, we can do for that.
So like the lower you get close to like the eyeball.
Correct. Right in, not on the wet line, but right where the lashes are. You okay?
Oh, I am fine.
Okay.
How long does that last?
It's permanent, but it does fade over the years, so you will want to touch it up probably every 3 to 5 years.
She's pretty brave.
She is.
Like 27 years ago, I had the bottom stuff.
It's all here.
It is a little lower, like she was saying, they went a little bit lower. But it depends on the person, because my mom has to wear cream, so she, you know,
Well,
she's out in the sun more. And,
Some people's skin just don't take to it.
yeah,
What does the sun do?
The sun can bleach it out.
in like any wear sunblock if you want your
Turn a little bit.
sunblock in your eye.
Yeah.
How many sweeps do you
When it's about like
There
eyebrows.
isn't really a number. I just do it till we have enough color in there. I'm going to widen this outer corner just a tiny bit.
So if you signed up for an appointment today, you'd get the 25% off?
You have to pay today to get the discount, but yes, then they could make you an appointment. Prickly? Okay. So we'll put some more numbing. Go back to the left.
So how many passes do you make on each?
There isn't really a number. It just depends on the skin and how we want to saturate into the skin enough color But everyone's different, you know, there's not really a finite number. It's just kind of like I see how it looks as I'm working.
That's the eyelids.
Does it come in different colors?
Uh-huh.
Bruising after this?
There can be bruising and swelling. Yes, it just depends on the person. If somebody's on blood thinning medicines, I do try to tell them you want to cut those out a couple weeks before. You know, aspirin, Motrin, fish oil, vitamin E, stuff like that will help minimize the bruising. But some people do get a little bit of pinpoint bruising on the eyeliner, and then the lids will look a little swollen like you've been crying for a couple days. And then I have you use Aquaphor ointment that I'll give to you that you put on 5 times a day. And that's to keep it kind of moist. Okay, I'm going to switch over there again.
Do you have pictures in a brochure, what the first step looks like?
In the
Like, how
book
much
right
is
on the
that?
counter outside the door, there's a book of a bunch of before and after pictures you can look at.
And the before picture, or the after pictures are just one dose or whatever you call this?
There's all different variations. It'll tell you
Oh,
right
okay.
on there what it is.
Tanya, just another thing.
Uh-huh.
Is today the only day you ever offer the 25% off?
Yes. So once a year type of thing.
Yeah. Not Monday.
Should be better, okay?
Mm-hmm.
Turn a little bit.
Are you doing her top and bottom?
Just uppers. She only wears on the top. The gal I did earlier this morning, we did top and bottom. A little better.
How many times do you have to go over it for the?
It just depends on the skin till we get enough color in there. Okay.
Yeah, I'm fine.
Yeah, it sure does. No, it doesn't. It's worth it.
She said it saves so much time.
Oh, it does.
It does.
I'm sorry, I misunderstood.
No, that's
Just
fine.
if it takes so long.
No,
It's not. Oh, yes, it's well
You
worth
spend
it.
5 minutes even just, every morning putting same makeup on.
Oh, it's wonderful. Yeah. Must have some skin heck of a story. What kind of a anesthetic did you use?
It's a topical numbing. It's a lidocaine and tetracaine. And it's pH balanced for the lids, and for, so it can get into the eye and not cause any harm to the cornea.
Did you drug her first?
No,
She's not making any noises.
she does not get any drugs. Now, some people we will do a Valium if they know that they're going to have a hard time. And we kind of talk about that at the consult because everyone's different,
You do long strokes instead of little feathers.
Not on the liner. The brows is where you do the hair stroke.
Oh, that's right. Thank you.
I'm starting to have that for a second.
Okay.
Can you do the brows and the eyelids at the same time?
Sure. Yeah. A lot of people do it together because they want to just have one downtime, one time of doing the ointment, and so it just depends on the person. If they know they're going to do both, they just do it all together.
Do you decide what size line they should have underneath, or do
Yeah, I mean, I kind of give you my recommendation. If somebody comes in and they're wearing really thick liner and they have small eyes and I don't think it looks good, I'll tell them, because it's my name on your face, So, That's why I like to see patients at consultation with their makeup on, so I can kind of see what they're used to
How long have
wearing.
you been doing this?
Since '03, I've been here 17 years. I'm the only one who does it. A little stinging here, hon.
Let me get back on that side. My bad.
Well, actually, I'm gonna be over here now.
Oh,
Yeah, you're good.
Yeah, she's one great lady.
She's doing great. We're on the home stretch.
What is that?
This is just an eye wash, and it just helps to cut down on the wiping. So I'm not wiping the skin a lot because that can cause it to get really sensitive and irritated. Turn this way. We're on the home stretch, girl.
Somebody left.
How does that affect dry eye?
It doesn't affect it anyway. Yeah. So if a patient has a dry eye, their eyes will feel the same, after.
Does it make them worse?
Not really. I mean, it might for a day or two, but it doesn't cause any long-term change on that. The eyelids will feel beat up for a couple days, so I always tell patients, have some cold compresses ready to go at home in case they feel a little swollen. I'm going to turn you a little bit on the home stretch here.
Is ink coming out of that needle or white?
Uh-huh.
In the black?
I dip it into the pigment and suck it up into the barrel, and then as the needle goes into the skin, it's pushing the color into the skin. So kind of like if you think of a sewing machine, pushing the material, the thread into the material. There we go. A little better?
Mm-hmm.
Prickly still?
Mhm.
Okay.
It's looking very pretty.
Yes, isn't it? She's gonna look gorgeous. And you want to plan this on a day when you know you're going to look a little beat up for a couple of hours. I wouldn't do it and then have an evening planned out or something, People will say, "What's wrong? Have you been crying?" Hang in there, honey.
Thank you.
You're welcome. Almost done, honey.
My bad. I don't want to be in your way.
No, you're good.
How much is it for the upper, the lower, and the brows?
Regular price is $9.50, and then you would take the 25% off. So I think it's $3.75 and $3.38, whatever the total is. That's today's price.
So who do you make the appointment with?
Up, Colleen can help you. And I did Colleen's eyeliner on the top about 4 months ago. I can't even remember now.
I think actually it was like 3 months ago.
Oh, okay.
I know, fun, right? So I've got
Now
eyeshadow
open
on
the
today.
right eye, Bree.
Turned it out for the
I'm gonna
other
end this
side.
and then take some pictures.